Hey everyone, and welcome to our deep dive this time into the world of integrative therapies. We're
Yeah.
going to be looking at a chapter from a psychotherapy textbook
hmm
and talking about all the different schools of thought and how they are,
Right.
you know, not exactly holding hands and singing Kumbaya,
Yeah.
getting closer.
Yeah. A lot closer than they used to be.
Much closer than they used to be, that's for sure.
Yeah.
So it's really interesting to see how therapists are kind of moving beyond this idea
Right.
of like, I'm just a psychodynamic therapist or I'm just a CBT therapist or whatever,
Right.
and thinking more about how those things can work together.
Exactly. And it's intriguing how it's changed so much because for decades, people were really trained in one school of thought.
Yeah.
And it was almost like that was the right one or the best one and the only way to do therapy. And that's really what makes this shift towards integration so interesting.
Yeah, it's like choosing your Hogwarts house and then never talking to anyone from Gryffindor if you're a Slytherin.
That's a great analogy.
But really, it's like, why wouldn't you want to learn from other people and what they're doing?
Right. And that's what's happening now. There's so much more openness to seeing what's out there and what other approaches have to offer.
Yeah. So what are some of the things that have kind of led to this movement toward integration?
Well, I think one of the biggest factors is just the sheer number of therapies that have been developed over the years.
Oh, yeah, it's overwhelming
It really is.
if you think about it.
It's like walking into a giant supermarket, with just aisles and aisles of cereal.
How do you choose?
Exactly. How do you know you're not missing out on something amazing?
You're just loyal to your childhood favorite.
Exactly. And what might work for one person with one problem might not work for another person with a different problem.
Yeah.
So,
Yeah.
What might be great for anxiety might not be so great for depression or trauma or relationship issues.
Right.
So therapists are realizing that they need more tools in their toolbox
It makes sense.
to really meet the needs of their clients.
Yeah, it's like you have a toolbox with a hammer and a screwdriver and a wrench and a saw.
Right.
But you wouldn't use a hammer to tighten a screw, would you?
No, you couldn't.
I mean, you could,
But
but
try.
it wouldn't be very effective.
And that's where this idea of integration comes in, because it's recognizing that you need different tools for different jobs.
Yeah.
And you have to be open to using a variety of techniques depending on the client and what they need.
That makes me think about all the times I've tried to fix something around the house
Uh-huh.
using only a butter knife.
Oh, yeah.
Maybe a wrench would have been a better choice.
Definitely.
So it's not just about practicality, though, right?
No, it's not.
There's also evidence that this approach can lead to better outcomes for clients.
Absolutely. And I think this is where the dodo bird verdict comes in.
Oh, yeah, the idea that all therapies are basically equally effective.
Right. But the interesting part is that while the specific type of therapy might not be the most important factor, the therapeutic relationship is. Having a good rapport with your therapist, feeling understood and supported can make a huge difference in whether therapy is successful.
Yeah.
And that's something that kind of transcends the specific techniques or the theoretical orientation.
So finding a therapist you click with is more important than worrying about, is this a psychodynamic therapist? Is this a CBT therapist?
It seems that way from the research.
Okay.
Of course, it's still important to find a therapist who, is using an approach that aligns with your values and your beliefs, but the quality of the relationship is really key.
So that's really helpful, I think, for anyone who's listening who's maybe feeling a little overwhelmed by all the different options out there.
Right.
Just knowing that, finding someone you trust and you feel comfortable with is probably the most important thing.
Absolutely. And then from there, you can explore the different approaches and see what feels like a good fit.
Okay, so let's talk about the different ways to actually go about this integration.
Okay.
Because I know the chapter highlights a distinction between technical eclecticism.
Yes, it does.
Those sound pretty technical.
They are a bit, but we can break them down.
Okay.
So think of technical eclecticism as like having a toolbox full of tools from different brands.
Right.
You might have a hammer from one company, a screwdriver from another, a wrench from a third.
Right.
You don't necessarily have to know the history of each company or the design philosophy behind each tool.
Yeah, you just care that it works.
Exactly. It's about practicality, using whatever tool is best for the job.
Right.
Now, theoretical integration is a bit more complex.
Right.
It's like taking parts from different tools and combining them to create a new hybrid tool
Oh, wow.
that's specifically designed for a particular task.
So instead of just borrowing tools from different toolboxes, you're actually building a new tool altogether.
You got it.
Wow, that's interesting.
And that's a key difference. Technical eclecticism is about selecting techniques from different therapies without necessarily adopting the theories behind them.
Yeah.
But theoretical integration is about trying to actually blend the theories themselves, creating this new framework that incorporates elements from multiple perspectives.
Okay, so I think a good analogy for this would be like
Okay.
technical eclecticism is like making a playlist of your favorite songs from different genres.
Okay.
But theoretical integration is like creating a whole new genre of music
Right.
by blending elements from different styles.
I like that analogy a lot.
Okay, good.
So are you ready to look at some real-world examples of these approaches?
Yes, I am. I love a good case study.
Let's do it.
So fire away.
So let's start with Paul Wachtel
Okay.
and his integrative psychodynamic behavior therapy.
So that sounds like it's combining psychodynamic therapy with behavior therapy.
Exactly. He recognized that both approaches have their strengths and their limitations.
Right, because psychodynamic therapy is great for exploring those deep-seated emotional patterns
Yes.
and, understanding how past experiences influence our present behavior.
Absolutely. But it's not always so great at providing concrete strategies for changing those patterns.
Yeah, it's like having a map that shows you where you've been, but doesn't tell you how to get to where you want to go.
Exactly right.
And on the other hand, you have behavior therapy, which is really good at targeting specific behaviors and developing those practical coping skills.
Yes.
But it doesn't always dig into the underlying emotional issues that might be driving those behaviors.
Right. It's like having a car but not knowing how to drive it.
Exactly.
So Wachtel's approach really tries to bridge that gap.
Okay, so it's like having a map, a car, and a driving instructor all in one.
I like that analogy, yeah.
Oh.
So one of the key concepts in Wachtel's approach is cyclical psychodynamics.
Okay, cyclical psychodynamics.
I know it sounds
A
intimidating,
little bit.
but it's actually a pretty simple idea.
Okay.
It basically means that our past experiences and our current behaviors influence each other
Okay.
in this kind of continuous loop.
So it's not just a one-way street.
No.
It's not just that our past shapes our present.
Right. It's that our present can actually influence our past.
Okay, how does that work?
So think of it like a feedback loop.
Okay.
Let's say someone grew up in a family where expressing emotions was really discouraged.
Okay.
So they learned to suppress their emotions and avoid conflict.
Right.
Now, as an adult, they might find themselves in relationships where they struggle to communicate their needs or assert themselves.
Yeah, I can see that.
And that, in turn, reinforces those old patterns,
Yeah.
making them feel even more stuck.
So it's like they're trapped in a cycle that keeps repeating itself.
Exactly. And that's why it's so important to address both the past and the present in therapy.
Okay.
We have to understand the root of the problem, but we also have to help people develop new skills and strategies for breaking free from those cycles.
Okay, so how does Wachtel's approach actually work in practice?
Well, he uses a blend of psychodynamic techniques like interpretation, exploring those past experiences, and then also behavioral techniques like exposure therapy and skills training.
So it's truly drawing from both worlds.
It is.
Wow.
And
Yeah.
the chapter gives this really great case study to illustrate how it works.
Okay, tell me about it. I'm ready.
Okay, so there's this 30-year-old chef
Okay.
who has a very clingy, dependent relationship with a wife, and it stems from his early childhood experiences where he lost his mother at a young age.
Oh, that's so sad.
It is.
Yeah, I can see how that would lead to some attachment issues.
Absolutely. And, a traditional psychodynamic approach might focus on just exploring those early childhood experiences.
Right, to help him understand where it's coming from.
Right. But Wachtel's approach goes a step further and recognizes that his current behaviors, like his clinginess and dependence on his wife, are actually perpetuating those fears.
Oh, so it's like a self-fulfilling prophecy.
Exactly.
Oh, wow.
And that's where the behavioral techniques come in.
Okay.
He might use techniques like assertiveness training to help him develop healthier ways of relating to his wife. And he might also use exposure therapy to gradually help him learn to tolerate being more independent.
So it's about both understanding the past and changing the present.
That's exactly it. It's not an either-or situation.
Yeah.
It's about recognizing that our past and present are interwoven, and that to change, we need to address both.
I really like how this approach acknowledges just the complexity of human experience.
Me too. And that's what makes these integrative therapies so exciting.
Yeah.
Because they allow us to tailor the treatment to the needs of the individual
Right.
and to draw from a wider range of tools and perspectives.
So we're not just limited by one school of thought.
No, we're not.
We kind of pull from all these different things to help people
Yeah.
in the best way possible.
Exactly.
I'm really starting to see the appeal of this integrative approach.
Great.
It seems so much more flexible and adaptable than just sticking to one thing.
It is.
So I know there are other examples of integrative therapies,
There are.
and one that really stood out to me in the chapter was Arnold Lazarus's multimodal therapy.
Yes,
Multimodal therapy. That sounds interesting.
it is.
Tell me about it.
So Lazarus was a pioneer in the field of technical eclecticism. He believed that effective therapy should address all aspects of the person's experience,
Okay.
not just their thoughts, feelings, or behaviors.
Yeah?
So he developed this model called Basic ID to guide this assessment.
Basic ID. That sounds like something out of a spy movie.
Yeah, I know, right?
What is it?
It stands for Behavior Effect, Sensation Imagery Cognition, Interpersonal Relationships, and Drugs Biology.
Wow. That covers a lot of ground.
He believed that by assessing all of those different modalities, you could create a really tailored and holistic treatment plan.
So it's kind of like a 360-degree view of the person.
Exactly. And he was also very flexible in his approach to treatment.
Okay.
He didn't believe in offering the same type of relationship to every client
Right.
or using the same techniques for every problem.
Okay.
He actually called himself an authentic chameleon.
An authentic chameleon.
I know it sounds like an oxymoron,
Yeah.
but it really captures his philosophy. He believed that therapists need to be able to shift gears and wear different hats depending on the client and the situation.
So it's about being adaptable and responsive rather than rigid and dogmatic.
Exactly.
Okay.
And there's a great example in the chapter
Okay.
of how this played out with a client. He was working with a woman who had a phobia of cats.
Okay. A cat phobia.
He initially tried systematic desensitization, which is a common technique for phobias, but it wasn't working.
Right.
So he actually drew on a technique from neuro-linguistic programming, or NLP.
Oh, wow.
Even though he didn't necessarily endorse all of the theory behind NLP, he was willing to use a technique from a different approach.
So it was really about finding what worked for that particular client.
Exactly. He was more interested in that than adhering to any particular theoretical dogma.
So it's really putting the client at the center.
It is.
And their needs and preferences.
Absolutely. And that's the power of this technical eclecticism.
Yeah.
It allows therapists to be creative and flexible and draw from a wider range of techniques.
I mean, this is all incredibly interesting.
Yeah,
I feel like I'm seeing the world of therapy in a whole new light.
that's great to hear. And we've just scratched the surface.
I know there's so much more to talk about.
There is. We've got to talk about effectiveness and ethical considerations and the training of therapists.
Yeah.
All of that.
Okay, well, I'm definitely hooked.
Good.
I can't wait to dive deeper into this in part 2 of our deep dive.
Me too.
So see you then.
See you then.
Welcome back to our deep dive into integrative therapies.
Yeah.
Last time we were talking about how there are so many different therapies out there
Right.
that it kind of forces the issue of like, maybe we should stop pretending that one is the best.
Exactly. It's like that old saying, when all you have is a hammer, everything looks like a nail.
That's so true. And I think that's what's really interesting about this movement toward integration is that it's moving beyond that,
Yeah.
my therapy is better than yours kind of mentality.
Exactly.
And really embracing the idea that different approaches can work together.
Right. And one of the really exciting things about this whole area is this concept of prescriptive matching.
Okay, prescriptive matching. That sounds interesting. Tell me more.
Yeah, so it's kind of like a matchmaking service for therapy.
Okay, I like that analogy.
Yeah, just like a good matchmaker considers the unique qualities and preferences of each person. Prescriptive matching is about finding the best treatment for the individual and their specific problem.
So instead of like a one-size-fits-all approach,
Right.
we're looking for that perfect fit.
Exactly. And it's not just some feel-good idea. It's actually really grounded in research.
Okay.
One of the pioneers in this field is Larry Butler, and he's done a ton of work on actually developing a system for matching specific therapies to certain client characteristics.
Wow. So what kind of factors are we talking about here? Like what makes one person a good match for one therapy and another person a good match for a totally different therapy?
So many things. It could be their personality, their coping style, their
Yeah.
level of motivation, their cultural background, their preferences for different types of therapy. The list goes on and on.
Wow. That sounds like a lot to take into account.
It is, but the payoff can be huge. So let me give you an example
Okay.
that Butler has studied extensively, which is the match between therapist directiveness and client resistance.
Okay. Break that down for me. What exactly do you mean by directiveness and resistance?
Okay, so therapist directiveness refers to how much the therapist kind of guides and structures the therapy sessions.
Okay.
So a highly directive therapist might give very specific advice, assign homework, take a really active role in the therapy process.
So it's kind of like having a coach who's really hands-on.
Exactly. Now, client resistance is, how much the client tends to resist change.
Yeah.
So a highly resistant client might be reluctant to talk about certain topics or miss appointments or just be generally less engaged.
Yeah, I can see how that would be challenging for any therapist.
It is. And here's where the matching comes in. So Butler's research found that clients with high resistance actually tend to do better with therapists who are less directive.
Wait, so if someone is resisting therapy, the best approach is to kind of back off a little bit.
Yeah, it seems counterintuitive.
Yeah, you would think they need someone who's really pushing them.
Right, you'd think they need a drill sergeant.
Yeah.
But it turns out that pushing too hard can actually backfire.
Okay.
It makes them feel more defensive and even less likely to engage in the process.
So it's almost like you're trying to force a square peg into a round hole.
Exactly. Instead, a less directive approach might use techniques like motivational interviewing, which really focuses on exploring the client's ambivalence about change and helps them come to their own conclusions about whether they want to change or not.
So it's about meeting the client where they are and gently guiding them.
Exactly. And this kind of matching can make a big difference in how successful therapy is.
So it's not just about finding a therapist that you like.
Right.
It's also about finding a therapist whose style is compatible with your personality.
Exactly, and it goes beyond directiveness and resistance. Another example is matching the type of therapy to the client's coping style.
Coping style. So how do you define that?
So Bettler and his colleagues found that people tend to fall into two broad coping styles: internalizers and externalizers.
Okay, so what's the difference?
Internalizers, they tend to blame themselves for problems and kind of turn their distress inward.
Right.
They might experience anxiety, depression, guilt.
So they kind of keep things bottled up.
Exactly. Externalizers, on the other hand, they blame other people or external circumstances
Okay.
for their problems, and they act out their distress through behaviors like aggression, substance abuse, risky behaviors.
So they're more likely to lash out or kind of seek distractions.
Exactly. And here's how it relates to matching.
Yeah.
So Butler's research suggests that internalizers tend to benefit more from insight-oriented therapies,
Okay.
like psychodynamic therapy or humanistic therapy.
Makes sense.
Yeah, these therapies focus on exploring emotions, understanding past experiences, developing self-awareness.
Yeah, because they're already beating themselves up.
Ex-
So you don't want to do more of that.
Right, you want to give them a different way of looking at things.
Okay.
Now, externalizers, on the other hand, they tend to do better with therapies that are more focused on behavior change and skill building,
Okay.
like CBT or behavioral therapy.
Gotcha.
So these therapies emphasize practical strategies for managing their symptoms, changing their behaviors, developing coping skills.
So it's about giving them the tools to manage their external expressions of distress.
Exactly. And again, this type of matching has been shown to lead to better outcomes in therapy.
It's so fascinating. It's like personalized medicine for psychotherapy.
It is. It's such an exciting development in this field.
It's so cool.
It's really moving us away from this one-size-fits-all approach to something that's much more tailored and effective.
I love that it's like finally acknowledging that everyone's different and everyone needs a different approach to healing.
Exactly. But it's important to acknowledge that integrative therapy does have its critics.
Right. Because nothing's perfect.
Of course not.
And I'm sure there's some valid concerns about blending different therapies together.
Yeah, and different schools of thought have their own perspectives and concerns. So let's start with the psychoanalytic camp.
Okay, bring on the Freudians.
Hmm.
What do they have to say about integrative therapy?
Okay, so some psychoanalytic critics argue that integrative therapies, especially the ones that emphasize behavior change or cognitive restructuring,
Yeah.
they might be neglecting the deeper unconscious roots of psychological distress.
So they're worried that they might be addressing the symptoms but not really resolving the core issues.
That's one concern, and they also might question whether these short-term integrative therapies can really create lasting change.
Right.
Given that psychoanalysis is all about this long process of exploration and working through these deep-seated patterns.
So it's like putting a Band-Aid on a broken bone.
Exactly. Now let's shift gears to the cognitive behavioral therapy camp.
Okay, what about CBT? Are they on board with this whole blending thing?
It's kind of mixed. Some CBT therapists are totally open to integrating techniques from other approaches as long as there's evidence to support them.
So they're like, show me the data.
Exactly. But others worry that too much eclecticism can actually lead to a lack of theoretical coherence
Okay.
and make it harder to study and refine treatment protocols.
So they're worried about losing the rigor and specificity of their approach.
That's a good way to put it. Yeah, they
Yeah.
might also question whether, adding in techniques from approaches that haven't been as well studied
Right.
could make CBT less effective.
I see their point.
Hmm.
So what about the humanists? Where do they stand on this?
Well, some humanistic critics worry that integrative therapies might be too focused on techniques and problem solving,
Okay.
and that they're neglecting the importance of the therapeutic relationship and empathy and personal growth.
So they're worried that the human element is getting lost.
Exactly. They might also question whether some of these integrative therapies, especially the ones that draw from behavioral or cognitive approaches, are really compatible with humanistic values.
Like self-acceptance and things like that.
Exactly.
It's so interesting how each perspective brings its own values and priorities.
It really is. And finally, we have to consider the cultural perspective.
Yes, because that's so important.
Yeah.
How does culture fit into all of this?
Right. And this is an area where integrative therapies have faced some criticism.
Okay.
Some multicultural critics point out that integrative therapies, as they're often practiced, just aren't culturally sensitive
Okay.
and may not be appropriate or effective for diverse populations.
So something that works really well for one culture might not work at all, or even be harmful for another.
Exactly. And some critics argue that integrative therapies, by trying to create this unified approach,
Yep.
might actually be perpetuating dominant cultural norms and values.
So instead of promoting inclusivity, it might actually reinforce existing power dynamics.
Exactly. It really highlights the need for these therapies to be much more culturally responsive
Yeah.
and to incorporate different perspectives.
This has been a whirlwind tour of the criticisms and challenges facing integrative therapy.
But, you know, it's a work in progress.
It sounds like there's still a lot of work to be done.
There is, but that's also what makes it so dynamic and exciting. We're constantly learning and adapting and trying to improve.
That's what I've loved about this conversation.
Yeah.
It's not just about presenting, here's the answer, this is how it is.
Right.
It's about being part of an ongoing conversation
Exactly.
about how therapy is evolving.
Absolutely. So as we wrap up our discussion of these criticisms, what are your main takeaways from this whole deep dive?
I think for me, the biggest takeaway is that integrative therapies aren't a one-size-fits-all solution.
Right.
They're really a shift in thinking,
Uh-huh.
a willingness to kind of look beyond the limits of a single school and to embrace the complexity of what it means to be human.
I love that that's a great way to put it.
And I think that's where this idea of prescriptive matching is so important.
Yeah.
It's about finding the right therapist, the right approach, and the right blend of techniques
Absolutely.
to really meet the needs of each person.
It requires a lot of knowledge about both the science and the art of therapy, staying up to date on the research, but also being sensitive to individual preferences and values and cultural background.
It's about being a lifelong learner and a compassionate practitioner.
Couldn't have said it better myself. And as this field continues to evolve, I'm so excited to see what the future holds for integrative therapies.
Me too.
Yeah.
I think it has so much potential to create a more personalized, effective, and compassionate way to approach mental health care.
Me too.
And to our listeners, if you're considering therapy, don't be afraid to ask questions and explore different options.
Yes.
Find a therapist who you connect with, who you feel comfortable with,
Right.
who's willing to work collaboratively with you, and who's really committed to finding the best path to healing and growth for you.
Well said. Until next time.
Keep those integrative minds churning.
Yes.
And remember, the journey to well-being is a personalized one.
And the right therapy can make all the difference.
All right, welcome back for the final part of our deep dive into integrative therapies. And, we've talked about a lot of different things. We've talked about why this movement is happening, how therapists are blending approaches, some of the challenges and criticisms. But there's one big question that we haven't really tackled yet.
Yeah, you're right. And that is, does it actually work? How do we measure the effectiveness of integrative therapies?
Exactly. It's all well and good to talk about, blending therapies and tailoring treatment, but ultimately we need to know, does this actually help people?
Absolutely. And that's where things get a little bit tricky because remember the dodo bird verdict that we talked about?
Yeah.
That all therapies are basically equally effective.
Right, and that always makes me wonder if all therapies work about the same. How can we say that integrative therapy is better?
That is the million-dollar question, and there's no simple answer to that because the dodo bird verdict is based on large-scale studies that compare groups of people. But when we zoom in on individuals, the picture is a lot more complicated.
So like the averages might look similar, but individual experiences can be really different.
Exactly, and that's where the art and science of prescriptive matching come into play because by really carefully assessing someone's unique characteristics and needs, we can increase the chances of finding the therapy that's going to work best for them.
So instead of asking, is integrative therapy better? We should be asking, is integrative therapy better for this specific person with these specific issues?
Exactly, and that's what personalized medicine is all about, and it's becoming more and more relevant in psychotherapy.
So it makes sense, but how do we actually prove that, an integrative approach was the best approach for a certain person?
Mm-hmm.
We can't just, experiment on people with different therapies until we find one that clicks.
Of course not. Ethical considerations aside, that would be a terrible idea.
Yeah.
That's where research comes in. We need studies that compare integrative therapies not only to controlled groups, but to other established therapies, and we have to take into account individual differences.
So we need more data, basically.
We need more data. We need to refine our understanding of how and why these therapies work.
Okay, and I know that's a challenge that a lot of researchers are working on right now.
They are.
We're starting to see more and more research on integrative therapy, so the evidence base is definitely growing.
It is.
But let's be real. Integrative therapy has its critics.
Of course it does.
What are some of the main arguments against this blended approach?
Well, as you can imagine, different schools of thought have their own perspectives and concerns. So let's start with the psychoanalytic camp.
Okay, so what do the Freudians have to say about integrative therapy?
Well, some psychoanalytic critics worry that integrative therapies, especially those that are really focused on behavior change or cognitive restructuring, might be missing the deeper unconscious roots of psychological distress.
So they're kind of worried that it's just addressing the symptoms without really getting to the core issues.
Right, and they might also question whether these short-term integrative therapies can really create lasting change.
Right, because psychoanalysis is all about that really in-depth exploration.
Exactly. It's a long process.
Okay, so it's kind of like they're saying you can't just put a Band-Aid on a deep wound and expect it to heal properly.
That's a great analogy.
All right, so what about CBT? What do they think about integrative therapy?
So it's a mixed bag. Some CBT therapists are open to integrating techniques from other approaches, but they really want to see the evidence.
Right, they want that data.
Exactly. They want to see the data. But other CBT therapists worry that too much eclecticism is going to lead to a lack of theoretical coherence,
Okay.
and that it's going to be harder to study and refine the treatment protocols.
So it's kind of like they're worried about losing the rigor of their approach.
That's one way to put it.
Mhm.
And they also worry that if you start integrating techniques from approaches that haven't been studied as much, that can make CBT less effective.
Yeah, that makes sense. So now what about the humanists? Where do they fall on this?
Well, some humanistic critics worry that integrative therapies are too focused on just techniques and problem solving, and that they might be overlooking the importance of the therapeutic relationship and empathy and personal growth.
So they're kind of worried that the human element is getting lost in the shuffle.
Exactly. They also might question whether some integrative therapies, especially those that borrow from behavioral or cognitive approaches, are really aligned with humanistic values like self-acceptance.
So it's fascinating to me how each of these perspectives brings its own set of values and priorities to the table.
It really is, and it's really important to consider all of them, and of course we have to consider the cultural perspective as well.
Yes, absolutely. So how does culture play into all of this?
That's a great question, and it's an area where integrative therapies have definitely been criticized
Okay.
because some multicultural critics point out that the way integrative therapies are often practiced just isn't culturally sensitive,
Okay.
and it might not be appropriate for diverse populations.
So basically, a therapy that works really well in one culture might not work or even be harmful in another culture.
Exactly, and some critics worry that integrative therapies, in this attempt to create one unified approach,
Right.
could actually be perpetuating dominant cultural norms and values.
So instead of being more inclusive, it could actually reinforce, the power dynamics that already exist.
That's a really important point, and it really highlights the need for these therapies to be more culturally responsive and to consider different perspectives.
Well, this has been a whirlwind tour of all the criticisms and challenges of integrative therapy.
It has.
It seems like there's still so much work to be done.
There is, but that's also what makes it so exciting.
Yeah,
It's a work in progress. We're constantly learning, adapting, and trying to make things better.
absolutely. And I think that's what I've really enjoyed about this conversation is that it's not about, here are the answers, this is the end all be all.
Right.
It's recognizing that this is an ongoing process.
It is.
And the field is constantly evolving.
Uh-
So as we wrap up this conversation about the criticisms,
Mhm.
what are your main takeaways from this entire deep dive into integrative therapies?
Well, for me, I think the biggest takeaway is that it's not a one-size-fits-all solution.
Right.
It's really about a shift in our thinking,
Yeah.
a willingness to look beyond, the limits of one specific school of thought and embrace the complexity of being human.
It's about recognizing that the best therapy is the one that works.
Exactly.
And that might not be the same for everybody.
And that's where this whole idea of prescriptive matching comes in.
Right. It's finding the right therapist, the
Yes.
right approach, the right blend of techniques to meet the needs of each individual person.
Absolutely. And it takes a lot of knowledge and skill to do that well.
Yeah, you have to really understand the research, but also be sensitive to the person's values and background and culture.
Exactly. It's about being a lifelong learner and a
Yeah.
compassionate practitioner.
Absolutely. And
Yep.
as this field continues to grow and evolve, I'm really excited to see what the future holds.
Me too. I
Yeah.
think it has incredible potential to make mental health care so much more personalized and effective and compassionate.
Absolutely. So to our listeners out there, if you're thinking about going to therapy, don't be afraid to ask questions.
Yes.
Explore different approaches. Find a therapist who you feel like you really connect with, who's willing to collaborate with you, and who's committed to finding the best path for you.
So well said.
Thank you so much for joining us on this deep dive into integrative therapies.
It's been a pleasure.
Remember that the journey to well-being is a personal one.
And the right therapy can make all the difference.